Endometriosis is a word that 1 in 10 women hear from their gynaecologist.
Yeah, it's one of the most commonly seen gynecological diseases, yet poorly understood and not commonly talked about. And here to tell us more about this painful condition is Professor Barry O'Reilly from the Mater Private Hospital in Cork.
Barry, great to have you on the show. First of all, what is endometriosis?
Yeah, I mean, endometriosis is a really common condition and very underreported or unrecognized, and it's quite difficult to explain, but it's the very specialized lining cells of the womb or the uterus, where every month in a woman's cycle they come away as a period. And sometimes these specialized cells can be found outside of the womb in different places. And if they do, then they bleed wherever they're implanted, whether it be in the abdominal cavity or whether it be on the ovaries. And if they bleed, they cause intense pain and discomfort. And that gives rise to the very difficult problems that women suffer from.
And Barry, you said there as well, it's very common. How common is it?
Well, as you said at the beginning there, about 10% of women suffer from this. This is women of reproductive ages, so it's anything from the onset, from young girls, the onset of periods to menopause. So, and then in fact beyond the menopause, even though they're not having periods anymore, these women can suffer from the kind of side effects of endometriosis with scarring in the abdomen, adhesions and that type of thing.
Barry, do we know what causes it?
Again, it's a very difficult one. There's been a huge amount of research globally on this condition, and we still haven't got very close to the cause of it. The hypotheses are, I suppose, the most popular one would be that the fallopian tubes that come out the top of the uterus allow menstruation each time the woman has a period to flow out. And because that menstruation, the bleeding comes out through the tubes and implants on the pelvic sidewall and cavity. So that's one theory, but really we don't know too much more about it.
And what should, if someone at home now is listening to this and never really heard of it before or is experiencing these problems, what should they do, or who should they speak to, or where should they go?
I think the most important thing, and I'm grateful that you're raising the topic today, is to raise awareness of this. And last month in March was the kind of global endometriosis awareness month. So it's important for women to know that this isn't, the fact that they can have intense period pains and complications associated with endometriosis, that this isn't just a normal part of being a woman, and that help can be sought. And so I would encourage them to go to their doctor and see if they can start the process of getting some alleviation of their symptoms.
Barry, from speaking to a few people who suffer from this, there is ongoing pain involved and severe pain in certain cases.
Yeah, I mean, pain is probably one of the most significant things, and I guess the commonest cause of it would be where the endometrial cells, those special cells that we talked about that line the womb, sometimes they can find their way into the muscular wall of the womb, and so every month when the woman has a period, that the uterus goes into intense spasm, and that causes those really bad period pains that sufferers can experience. With time off work, it has a huge impact on quality of life. So there's strong links with depression, with time off work. It's a very difficult condition to cope with. So I really would encourage women to go forward and seek help.
And then how is it treated then exactly?
Well, again, the main driver of endometriosis is one part of the two female hormones that women have, which is estrogen. So every month when these cells in the womb come away in a period, whatever we can do to stop that happening, to cease the periods temporarily or for a few months at a time is very useful. So we can prescribe the contraceptive pill, for example, where that can be taken back to back, and that will dampen down the period response. There are other hormonal treatments that we can give. It's often a multidisciplinary approach, so we have a very effective team in the Mater Private with pain specialists, with colorectal surgeons and that type of thing, because sometimes quite drastic surgery is required to free up the pelvic organs and take away the endometriosis. And of course, one thing we haven't touched on is the fertility issues that many of these women experience.
Can you tell us a bit more about that, Barry, please, the link between endometriosis and fertility problems?
Well, often it's one of the presenting symptoms, if you like. So a woman who might be trying to have a baby for quite a while will go to her doctor, and that's where we can put the pieces together to come up with the diagnosis. So what happens is if those specialized cells that we talked about, if they're implanted on the ovary, they can cause quite significant ovarian cysts, and that will interfere with egg release during ovulation. The other aspect is if there are adhesions or if the endometriosis is lining the inside of the abdominal wall, the bowel can become very sticky and can stick around the fallopian tubes, and that will obstruct them, and that causes difficulty in terms of the egg transferring to the uterus for a pregnancy to be achieved.
Professor Barry O'Reilly, thank you very much for being with us today. And remember to contact your GP if you've been affected by any of what we've just been speaking about.
Yeah.